In the US, immigrants make up nearly 14% of the population, yet many face significant barriers to accessing healthcare. Addressing healthcare access for immigrants isn't just about inclusivity, it's about improving public health for everyone. Some of the challenges immigrants face include language barriers, cultural differences, and immigration status. Barriers specific to healthcare access might include limited insurance, high out-of-pocket costs, and general fear and distrust. These issues combined make it very difficult for immigrants to access healthcare services. Some immigrants may avoid the doctor's office altogether because of these barriers, causing them to be sicker. Meet Sue. She came to the US just a few years ago from Vietnam. When she got sick, she was nervous to visit a doctor because her English wasn't very good, and she was worried they wouldn't be able to communicate well. But now, she's upset and sick. Her illness continues to get worse, and eventually she goes to the hospital to treat her symptoms. This should not be the normal for the US healthcare system. We can change. So how can we accommodate these immigrants? Medical offices can provide translation services. Patients can indicate if they need this service ahead of time so the office can be prepared. Regular cultural discussions should be a mandatory part of training in medical facilities. This would help medical personnel be more equipped. During the immigration process, information regarding healthcare should be provided. This would help immigrants know where they could go to see a healthcare provider, being a citizen or not. For lack of insurance or high out-of-pocket costs, there's not much that can be done in the hospitals despite changing Medicare laws. This is a challenge. However, to address the general fear and distrust of hospitals and or clinics, posters, handouts, and video walkthroughs can be made for patients coming in for the first time. Healthcare facilities can successfully address 4 out of 6 of the immigrant barriers to the U.S. healthcare system. Remember, millions of people immigrate to the United States each year, and 1 in 4 report difficulties navigating the healthcare system. We can make the U.S. healthcare system more inviting to immigrants as we help them make America their new home. You can help make this change. Thank you.